Hey everyone, welcome to another deep dive.
Ooh.
You guys are all so busy, so we're going to cut to the chase today and dive straight into the fascinating world of cycloplegic exams for kids.
That's right.
And to do that, we are taking inspiration from a recent article in Clinical Optometry called
Cycloplegia in Children, an optometrist's perspective. A
Exactly.
great read.
You can find the full article linked in the description. But
Yeah.
for now, we'll break it down for you and give you the need-to-know info.
Exactly.
Now, we all know that accurately figuring out a kid's prescription can be
Challenging.
Yeah.
Very,
It
very.
can be like trying to herd cats sometimes
Right.
because their accommodation is just so strong.
It's incredible.
So tell us, why are these cycloplegic exams so crucial? I mean, sure, they're the gold standard, but let's go a little deeper for our listeners.
Absolutely. So cycloplegia temporarily paralyzes those ciliary muscles.
Right.
It's like hitting the pause button on accommodation.
I like that.
It allows us to really get a clear view of their true refractive error.
It's like when you finally get those 3D glasses to work at the movies and everything snaps into focus.
Exactly.
Okay, so now we're all seeing 20/20 on the importance of cycloplegia. But in what real-world scenarios does it really make a difference?
Oh, well, you can imagine a child who's struggling in school. Maybe they're labeled as inattentive or even a slow learner.
Okay,
And the parents are worried, the teachers are frustrated,
of course.
and the child's self-esteem is really taking a hit.
Yeah, that's a tough situation.
And it is. But what if the root cause isn't a learning disability at all?
Ooh.
What if it's simply uncorrected farsightedness that's
Wow.
masked by their amazing accommodation?
Wow, that's incredible. I never thought about it that way.
It's a game changer.
It really is.
Early detection is key.
Makes sense.
And both the AOA and the AAO recommend these exams for initial pediatric assessments as well as for cases of amblyopia or strabismus.
I think it's really remarkable how powerful early intervention can be.
Oh, absolutely.
And cycloplegia plays a vital role in making that happen.
Yeah, and here's a fascinating tidbit.
Okay, I'm ready.
Research has actually shown that even young adults up to age 20
Wow.
can still over-accommodate.
Really?
Yeah,
That's amazing.
leading to, underestimation of their hyperopia.
That makes you wonder how many adults are out there thinking their blurry vision is just part of getting older when it could be easily corrected.
Right. It's mind-blowing.
Okay, so let's move on to the cycloplegic agents themselves.
Okay.
It's like we have this menu of options, each with its own, pros and cons.
Right.
We've got the strong ones like atropine
The workhorses like cyclopentolate.
and the gentler options like tropicamide.
Mm-hmm.
How do we even decide which one to use?
Well, think of atropine like a strong cup of coffee to kickstart your day.
Oh, I like that analogy.
It's powerful and long-lasting.
Mm-hmm.
But with a potential caffeine crash, it can last up to 14 days.
Oh, yeah. I remember learning about those side effects in optometry school.
It's like that old saying, blind as a bat, hot as a hair, dry as a bone, red as a beet, mad as a hatter.
Yeah, not the best experience for a kid, or for their parents for that matter.
Definitely. And it's actually contraindicated for children with Down syndrome.
Good point.
So it's not a one-size-fits-all solution.
Right.
Now, if atropine is your espresso,
Okay.
cyclopentolate is more like your trusty cup of joe. It gets the job done without the jitters.
I like that.
It's a great balance of effectiveness and duration.
Makes sense.
The effects last about 24 hours.
Okay.
That's why it's often the cycloplegic of choice for most kids.
Okay. So then what about tropicamide? Is that our decaf option?
You could say that.
Okay.
Yeah, it's the gentle giant.
Gentle giant. I like it.
Yeah. The shortest duration of action, around 1 to 2 hours.
Okay.
And the lowest risk profile.
Huh.
Perfect for those quick checks or for kids who might be more sensitive to those longer acting agents.
So it seems like picking the right cycloplegic agent really comes down to weighing those factors.
Right.
Efficacy, duration,
Yeah.
and of course the potential side effects.
Absolutely.
So let's talk about what the research actually says about how well these different agents work.
Okay.
There are studies showing that cyclopentolate is just as effective as atropine for most kids.
Yeah.
Except for those with like large accommodative esotropia.
Mm-hmm.
So that means we can often choose cyclopentolate
Right.
and avoid those longer lasting effects and potential complications of atropine.
Exactly.
That's great news.
It is.
It's like finding out you can get the same caffeine kick from a regular coffee as an espresso with fewer jitters.
Exactly.
I love that.
Okay.
Okay, so what about tropicamide? Does it stack up in terms of effectiveness?
You bet. The research actually shows that it can be enough even in children with high hyperopia.
Wow, that's amazing.
It is.
Yeah.
And it has that lower toxicity compared to atropine,
Right.
which is always a win.
Always a win. So it sounds like we've got a pretty good range of options, each with their own strengths.
Mm-hmm.
But let's be real for a second. Administering these drops can be a whole other challenge,
Oh, absolutely.
especially with kids who are, well, let's just say less than thrilled about the idea.
It can be like trying to hit a moving target,
Yeah.
especially if that target's screaming, squirming, and convinced you're trying to,
Yeah.
poison them with eye drops.
Yeah, exactly.
But don't worry, there are strategies to make the whole process smoother and less traumatic for everyone.
Okay, good. I was hoping you'd say that.
We'll dive into all of that in part 2 of this deep dive.
I can't wait.
Yeah.
But before we move on, I want to remind everyone we've got a link to that full journal article in the description.
Mm-hmm.
Definitely check it out if you want to get all those nitty-gritty details. Yeah. And don't forget to hit that follow button so you don't miss part 2.
That's right.
Now, if you're already loving this deep dive, leave us a 5-star review.
Yes, please.
It helps other eye care professionals find us. Okay, we'll be right back after a word from our sponsors.
We'll see you soon. Welcome back, everyone.
All right, let's jump right back into our cycloplegic adventure. But before the break, we were talking about those practical tips and tricks for actually, administering the drops.
Right. I think one of the most important things is communication.
Okay.
Before we even touch the drops, I make sure to talk to the child and the parents.
Mm-hmm.
Explain what's going to happen, why we're doing it, what they can expect.
Yeah, I think that makes a lot of sense.
Yeah, it helps reduce the anxiety.
Absolutely.
Yeah.
I've definitely found that kids are a lot more cooperative when they at least kind of understand what's going on.
Yeah.
Even if they don't love the idea of eye drops.
Right.
So what kind of language do you actually use with the kids?
Well, I try to keep it very simple,
Right.
age appropriate. I don't use any jargon,
Mhm.
like cycloplegia or accommodation.
Yeah.
I just say, we're going to put some special drops in your eyes.
Okay.
That'll help us see how well your eyes are working.
I like that.
And with younger kids, I always emphasize that it won't hurt,
Right.
even if it feels a little weird.
Yeah, that's a good point.
It's all about managing expectations.
Honesty and reassurance go a long way, I think.
Mm-hmm.
Okay, so let's get into the actual technique of getting those drops in.
Right.
Do you have any, special tips or tricks you can share?
Oh, well, first and foremost, make sure you've got good technique.
Mm-hmm.
If you're a little rusty or unsure,
Yeah.
don't hesitate to ask a colleague for some pointers or practice on a doll or a teddy bear.
Right.
Your little patience will appreciate it.
Practice makes perfect, right?
Absolutely.
Now, what about those kids who just can't seem to sit still no matter how hard we try?
Ah, the wigglers.
Yeah,
They're the best.
they are.
Distraction can be key.
Okay.
I've had good luck with singing a song,
Oh, fuck.
having them look at a colorful picture,
Mhm.
or even letting them hold a special toy.
Right.
And for those really clingy kids, letting them sit on their parents' lap or hold their hand can make a world of difference.
It's all about comfort and security.
Exactly.
So it sounds like flexibility and adaptability are key here.
Mm-hmm.
There's no one-size-fits-all approach.
Right. You got to read the room, tailor your approach
Yeah,
to each kid.
absolutely. And patience is a superpower.
Patience is everything.
It is.
If the kid's really struggling,
Yeah,
don't be afraid to take a break.
right.
Try again later.
Okay.
Maybe even use a different method of administration, like a spray.
Oh, that's a good point.
Oh,
Okay, speaking of administration,
right.
let's talk about dosing.
All right.
I know our listeners are eager to hear some specifics here.
I bet.
So what are your go-to concentrations for different age groups?
Well, I like to follow the AOA guidelines pretty closely. So for infants under a year old, I usually start with cyclopentolate 0.5%.
All right.
And for those over 1 year,
Mm-hmm.
I'll bump it up to cyclopentolate 1%.
Okay.
But of course, you always have to consider each child individually,
Yeah.
and adjust as needed.
Absolutely.
Yeah.
It's not always about following a rigid formula.
Right.
Sometimes you just got to use your best clinical judgment
Exactly.
and make those little adjustments based on the individual child.
Exactly. And if cyclopentolate just isn't an option,
Mm-hmm.
maybe the kid has a sensitivity
Oh,
or
yeah.
there's a supply issue,
Yeah.
tropicamide can be a good alternative,
Okay.
especially for infants who don't have strabismus.
Right.
Usually I'll use 0.5% or 1%.
Makes sense. So we've got a good selection of cycloplegic agents to work with.
We do.
But before we wrap things up,
Mm-hmm.
I want to talk about potential side effects.
Okay.
Every medication can have them.
Right.
And cycloplegics are no exception.
Right. Important to be aware of those potential side effects.
Yeah,
And to educate the parents about what to watch for.
absolutely.
Mm.
So with atropine, like we talked about before,
Mm-hmm.
We're mainly worried about those systemic anticholinergic effects.
Right.
Dry mouth, flushed skin,
Rapid heartbeat.
even delirium in some cases.
Yeah. Not fun.
Definitely not something we want to see.
Not at all.
What about cyclopentolate and tropicamide? Are they associated with similar side effects?
Well, cyclopentolate works in a similar way to atropine.
Okay.
So those side effects are possible, but they're usually less common and less severe.
Okay.
And tropicamide, with its shorter duration of action, generally has a milder side effect profile.
Gotcha. But we still got to be on the lookout.
Oh, absolutely.
For things like allergic reactions, drowsiness,
Right.
eye irritation.
Yep. Vigilance is key.
Vigilance is key no matter what.
Exact.
You know, one thing I found really helpful
is
is to apply gentle pressure to the nasolacrimal sac for a minute or two after putting the drops in.
Oh, yeah, that's a good one.
It helps prevent the medication from being absorbed into the bloodstream.
It really does.
Little things like that can make a big difference.
They do.
You know, we've covered a lot today.
We have.
But I feel like there's this one big thing we haven't really talked about.
What's that?
Myopia.
Oh, right.
The myopia epidemic.
It's the elephant in the room.
It is. It's a topic on every eye care professional's mind these days. Those myopia rates are going up.
Skyrocketing.
And we're all trying to find effective ways to slow it down.
Absolutely.
So where does cycloplegia fit into all of this?
Well, cycloplegia itself isn't a myopia treatment,
Okay.
but it can help us understand and manage this complex condition.
Okay.
For starters, it gives us the most accurate measurement of the refractive error,
Right.
which is crucial for determining the treatment strategy.
Absolutely.
Whether that's glasses or contacts or other myopia control therapies.
Like the foundation of the whole thing.
It is. If we don't have an accurate measurement, we could end up undercorrecting the child.
Right.
Which could make the myopia progress even faster.
Which is the opposite of what we want.
Exactly. And cycloplegia can also help us find those kids who have latent hyperopia.
Yeah, that hidden hyperopia.
That they can kind of compensate for, but it puts extra strain on their system and might increase their risk of myopia.
So by unmasking that latent hyperopia,
exactly,
we can address it early and maybe even reduce their risk.
Exactly. And there's some really cool research coming out that suggests that cycloplegic exams could help us identify kids who have a higher accommodative lag.
Interesting.
Which is the difference between their accommodative response and the stimulus.
I see.
Some studies have actually linked a higher lag to a faster rate of myopia progression.
Fascinating.
Yeah.
So we're not just talking about using cycloplegia for accurate measurement,
right,
but also as a potential tool for figuring out those risk factors.
Absolutely.
For myopia.
It's adding a whole new layer of insight.
It is. It's exciting.
It is.
The more information we have, the better equipped we are to make those decisions.
Absolutely.
About treatment and management for our patients.
For sure.
This has been such a great discussion.
It has been.
Really eye-opening.
I agree.
I feel like I've learned so much about cycloplegic exams.
Yeah. But we're running out of time for this deep dive.
I know.
But don't worry.
Okay.
We'll be back for part 3,
where
we'll talk about some further research
great.
in the area of cycloplegia in children.
Sounds good. Welcome back to the deep dive.
It's great to be back.
So before we took a little break, we were getting deep into that myopia epidemic.
Yeah. We were exploring how cycloplegia can give us a more accurate understanding of a child's refractive error and, you know, even identify some of those risk factors.
It's really fascinating to see how much research is being done in this area. There's always something new to discover.
Oh, absolutely. And one study I came across that really piqued my interest was looking at how effective cyclopentolate is compared to atropine in getting cycloplegia in kids.
Oh, yeah. I think we talked about that a bit earlier.
We did touch on it, but this study took a deeper dive.
Okay. I'm interested. Tell me more.
They compared the effects of 1% cyclopentolate and 1% atropine in a group of children between 3 and 12 years old.
Okay, I'm all ears. What did they find?
Well, the results showed that both were effective, but atropine had a longer and stronger effect.
That makes sense. Atropine is definitely known for its potency.
Right. But what's interesting is they also found that cyclopentolate was enough for most routine eye exams in children.
So basically, unless it's a complicated case or we think there might be a high degree of latent hyperopia, cyclopentolate is probably the better choice.
Exactly, especially when you consider the potential side effects and longer recovery time that comes with atropine.
Right. It's always about that balance between effectiveness and Making sure the experience is as easy as possible for everyone.
Right, finding that sweet spot.
Okay, what other studies caught your eye?
Well, another one looked at using cycloplegia to diagnose accommodative esotropia.
Accommodative esotropia, that's where the eyes turn inward from too much focusing effort, right?
Exactly, and it's a very common type of strabismus in kids, and cycloplegia is crucial for diagnosing and treating it.
I definitely seen a lot of those cases in my practice. What did they find in the study?
Well, they use cyclopentalate to relax the focusing in a group of kids with accommodative esotropia.
Right.
And they found that in most cases, it significantly reduced how much the eyes turned inward.
That makes sense. By removing that focusing effort, we're giving those eye muscles a break and letting the eyes straighten out.
Exactly. And this study really highlights why cycloplegia is so important in telling the difference between true esotropia and accommodative esotropia.
Right, because they need to be treated differently.
Absolutely. We wouldn't want to prescribe glasses to a child with true esotropia when they really need vision therapy or even surgery.
Definitely not.
Mhm.
Cycloplegia helps us get to the bottom of things and make sure we're giving each child the right treatment.
Couldn't have said it better myself.
Well, I have to say, this has been incredibly insightful. It feels like I've gained a whole new understanding of what cycloplegic exams can tell us.
I'm glad to hear it. But remember, this is just the tip of the iceberg when it comes to research on cycloplegia. There's so much more out there.
I know. And I'm already excited to see what the future holds for this area of pediatric eye care. But for now, we've reached the end of our deep dive on cycloplegic exams in children. Hopefully everyone listening feels a little more confident in understanding these exams and how to use that knowledge in their practice.
I hope so too. And if anyone has any lingering questions or wants to share their own experiences with cycloplegia, we would love to hear from you in the comments.
Yes, please join the conversation. And before we say goodbye, be sure to hit that follow button so you don't miss out on any future deep dives. We have some amazing topics coming up, covering everything from dry eye to the latest and greatest in contact lenses.
And if you enjoyed this episode, please do us a favor and leave us a 5-star rating. It helps other eye care professionals find us and learn alongside us.
All right, folks, that's it for today's deep dive. We'll see you next time. And in the meantime, remember to keep those eyes healthy
And happy.